Certainly, as part of the COVID story, we have reported on and shared with you scenes of chaos, tragedy, and outrage at Canadian long-term care homes. There is a report out just this morning that details how devastating the first and second waves of COVID-19 were in those homes. And it finds that Canada holds the worst record among wealthy nations for COVID-19 nursing home deaths. Now, David Common, as you know, has been investigating the story and reporting on it extensively throughout the pandemic. He's here looking at this report. David, what stands out as someone who has, as I said, followed these issues so closely? What is most important in this report that you're learning?
A number of things, Heather. It is a brutal assessment of Canada's performance, if you can call it that, in terms of long-term care during the pandemic. What this shows is that 69% of our deaths have occurred in long-term care. That compares to the international average of 41%. Gives you a real sense of where the price has been paid in terms of both cases and deaths, and speaks to the level of protection and the state of long-term care going into this pandemic. But there are other things too, Heather, notably the differences between the approach in the first and the second wave. So the first wave,
I fear that we may have lost.
But you also saw.
Sorry, you know what, David? We just lost your connection just for a moment, your video connection, but I'm hearing you fine. So if you wouldn't mind just backing up and that last sentence, I'd like to hear it again, please.
Absolutely, Heather. I will just point out that what it notably points out is the differences in how some provinces approach this, notably between that first and second wave. So we get hit by that first wave, really bad in some provinces, notably Ontario and Quebec. But here's where the differences take over. Quebec, in between that first and second wave, takes a whole bunch of measures, hires more staff, really gets in on infection prevention and control measures, and as a result, sees a difference in its second wave. Ontario, by contrast, sees an increase in the number of cases and deaths in long-term care. So do the prairie provinces, Manitoba, Saskatchewan, Alberta, which were largely spared during the first wave, and some critics have said perhaps they thought they weren't going to be affected, only to see exponential growth in cases and deaths in long-term care in those provinces. They're not the only ones. British Columbia also impacted there. But big ones, we look at Ontario, Manitoba, Saskatchewan, and Alberta in terms of the differences during that second wave, perhaps speaking to their level of preparedness.
Is there likely, after all of this and after yet another report, David, to be any substantive change?
I think that's the big question, Heather. Many advocates who have long argued for better funding in particular are saying, look, Canada actually pays a third less for long-term care than other wealthy nations in the world, and you get what you pay for. And we were getting what we paid for before the pandemic hit. Infectious diseases still were moving through long-term care, and long-term care is still going to be there after COVID. This report also notes that a number of provincial inquiries are underway, and they're all recommending basically the same thing. You need more staffing, you need better funding, and you need more infection prevention and control and training for staff. They're unified in terms of this approach, but a lot of the advocates for long-term care believe that as we come out of this pandemic with huge deficits, they worry some of the first places that will get hit in terms of funding are seniors' care. I want to just play you a short clip of Dr. Samir Sinha, a geriatrician.
The one thing that defines Canada's long-term care systems is they're grossly underfunded compared to an international OECD average. We fund our long-term care systems, whether it be from home and community care all the way to nursing home care, by a third less than the average industrialized nation in the world. When you actually underfund the system, what we see is that you actually have lower levels of staffing, you have poor infection prevention and control measures, you don't have the quality facilities that we actually require.
Hey, look, I'll just point out something I have pointed out before, Heather, very briefly, and it's really on the floor level of care. Forget about COVID for a moment. The people in long-term care have complex health needs. They're often very vulnerable. And it is not unusual, whether you're in Ontario or another province, to have just 3 frontline personal support workers caring for 30 very frail people and just getting them out of bed, getting them dressed, getting them to the toilet, getting them showered. It's an enormous task, and there simply isn't the time for a lot of those staff, as we've seen before many times, to be able to pull it off. Forget about this happening during COVID. The cost during COVID is that we're already on the cliff's edge, and a big wind came along and pushed everyone over.
David Common, as always, thank you very much. David continues to look at the reality in Canada's long-term care facilities.